We are Discussion Group 2, the RX Squad, and our supplement was Red Yeast Rice.
Red yeast rice is the product of yeast grown on rice. It is a dietary staple in some Asian countries. Processed yet red yeast rice supplements include red yeast rice extract, which is any extract of red yeast rice, and Zhu Zai Kang, an alcohol extract of red yeast rice. It is also known as cholesterol, red rice yeast, Zhu Zai Kang, and Zai Tai.
Red yeast rice was first documented in 880 in the Tang Dynasty of China. Detailed description of how the product is manufactured was recorded in the ancient Chinese pharmacopoeia published during the Ming Dynasty. In this text, red yeast rice, which contains the active ingredient monocholine K, was used as a mild aid for gastric problems, blood circulation, spleen, and stomach health. Following the discovery of monocholine K in the late 1970s, red yeast rice extracts were introduced and sold as dietary supplements in the United States to help lower cholesterol in patients. However, monocholine K and lovastatin, another drug used in treating cholesterol, are both similar in structure and function and therefore chemically similar. In 1997, the FDA banned the importation and sale of red yeast rice on the grounds that it was an unapproved drug and not a dietary supplement. After a series of legal battles between the FDA and pharmaceutical companies that manufactured and sold red yeast rice extracts, it was finally ruled that red yeast rice should not be sold as a dietary supplement, especially if it contained significant amounts of monocholine K. As a result, many pharmaceutical companies stopped the manufacture and distribution of red yeast rice extracts by switching to other ingredients, while others sold red yeast rice products containing very low amounts of monocholine K.
The most common uses for red yeast rice are the treatment of hyperlipidemia and for its anti-cancer effects. Hyperlipidemia consists of high fat and cholesterol levels, which red yeast rice has been shown to reduce. This in turn leads to a decreased risk of cardiovascular disease. Red yeast rice has also been shown to reduce the risk of colon cancer. It is now being studied for the possible treatment of colon cancer, as well as for its potential as a risk reducer for other forms of cancer, such as prostate cancer.
The potential benefits stem from the main constituent known as monocholine K. This is an inhibitor of beta-hydroxy beta-methylglutarate-CoA, also known as HMG-CoA reductase. This enzyme is involved in the synthesis of cholesterol. Therefore, the potential benefits include lowering of LDL cholesterol levels and therefore increase the prevention of coronary heart disease. However, this supplement is not FDA approved because it includes monocholine K, which is also known as lovastatin. And since lovastatin can interfere with other medications, it is not regulated. And also in the supplement, it is hard to know how much monocholine K is included.
Red yeast rice is likely unsafe to use during pregnancy. There are studies that have shown that a part of red yeast called lovastatin has been known to cause fetal skeletal malformations in animal studies. There is not sufficient research about red yeast rice use during lactation, so it is recommended that it is not used during lactation. Studies have shown that red yeast rice side effects are mild, like headaches, heartburn, and upset stomach. There are contradicting studies that claim red yeast rice both increases and decreases liver enzyme levels. Therefore, it should be used cautiously, and people taking red yeast rice should have liver function tests regularly.
Red yeast rice contains the statin drug lovastatin, which has been shown to increase the risk of liver damage in some patients during concurrent substantial consumption of alcohol. This interaction carries a moderate interaction rating. Concurrent use of red yeast rice and cyclosporin, a CYP3A4 inhibitor, may result in an increased risk of elevated creatine phosphokinase values and myopathy. This probable drug interaction has been shown to result in serious rhabdomyolysis, which is a condition in which damaged skeletal muscle starts to break down rapidly. Symptoms may include muscle pains, weakness, vomiting, and confusion. This interaction has a major interaction rating. Other CYP3A4 inhibitors like erythromycin and ketoconazole might increase lovastatin levels by inhibiting metabolism of red yeast rice, potentially increasing the risk of adverse effects. And also, the concurrent use of red yeast rice and grapefruit or grapefruit juice may result in increased plasma levels of lovastatin and an increased risk of myopathy or rhabdomyolysis.
Lovastatin can interact with many drugs, and the amount of this active ingredient in the red yeast rice is not always known, so practitioners should be aware of these risks and be sure to warn patients about them. Pregnant women, people taking CYP3A4 inhibitors like cyclosporin, erythromycin, or ketoconazole should not take red yeast rice due to possible drug interactions. The possibility for liver damage is increased with use of red yeast rice, so people with previous liver damage should not take this supplement. Also, alcohol consumers should use caution when drinking alcohol and taking red yeast rice, as this may increase the possibility of liver damage. There are a wide range of doses that a patient can take, but the most common is 600 to 1200 milligrams of red yeast rice extract 1 to 3 times a day. This dose should be lessened if the patient experiences any adverse effects or increased if no benefits of the drug are seen.
These are the references that we used. We used a variety of sources, including natural medicines. Feel free to direct any questions to any member of the RX squad, and if you want to send an email to the above address, that is perfectly fine too. Thank you.